Hello and welcome to Chapter 6, the lower extremity. In this presentation, we will discuss lower extremity anatomy, specifically the toe, foot, and calcaneus. We'll discuss ankle and tib fib in a separate lecture. So let's get started. The bones of the distal lower limb, as you know, are divided into the foot, the lower leg, and the distal femur. And when we say distal femur, we're referring to knee joint. The ankle and the knee joints are also discussed in this chapter, and again, we'll get to those in different presentations. The proximal femur and the hip are included in Chapter 7, along with the pelvic girdle. So, the bones of the foot, as you already know, are very similar to the bones of the hand and the wrist. And remember, we learned hand and wrist back in Chapter 4. There are 26 bones in one foot, and they are divided into 3 different groups. So, phalanges, remember phalanges are the segments of bone within a digit. Metatarsals, there's 5, and 7 tarsals. So let's talk about each part of the foot in a bit more detail. The most distal bones of the foot are the phalanges, which make up the toes or the digits. The 5 digits of each foot are numbered 1 through 5, just like the hand. Number 1 starts on the medial side with the big toe. Number 5 then is the pinky. The large toe, or the first digit, has only 2 phalanges, very similar to the thumb, right? The proximal phalanx and the distal phalanx, so this would be the interphalangeal joint. Each of the second, third, fourth, and fifth digits has a middle phalanx, in addition to the proximal and the distal. Because the first digit only has 2, and digits 2 through 5 have 3 apiece, that means there are 14 total phalanges in each foot. And again, that's exactly like the hand. It's worth noting, though, that the phalanges of the foot are much smaller and their movements are more limited than those of the phalanges in the hands. So, of course, the phalanges here in the first toe are pretty big, but like these phalanges in the pinky are pretty small. Okay, remember, when you are describing bones or joints of the foot, always identify the specific digit and foot. So, for example, you could say the right first distal phalanx, and we would know you are talking about the end of the big toe. Okay, next, metatarsals. There are 5 metatarsals, and they are numbered along with the digits. So the first metatarsal is on the medial side of the foot, and number 5 is on the lateral side. Each of the metatarsals contains 3 parts. The small, rounded distal portion of each metatarsal is the head. The centrally located long, slender portion is the body or the shaft of the metatarsal. And then this expanded proximal end of each metatarsal is the base. The base of the 5th metatarsal kind of expands laterally here into a prominent rough tuberosity, which provides for the attachment of a tendon. The proximal portion of the 5th metatarsal, including the tuberosity, is easily identified on a radiograph, and truthfully, it's a pretty common trauma site for the foot. Okay, next, let's discuss the joints of the digits. The joints of the digits of each foot are important to identify because fractures may involve those joint surfaces. And remember, we practice this with the hand. Each joint of the foot has a name derived from the 2 bones on either side of the joint. So between the proximal and distal phalanges of the first digit, remember, then would be the interphalangeal joint or the IP joint. And again, because digits 2 through 5 each have 3 bones, These digits also have 2 joints each. Remember, between the middle and the distal phalanges is the distal interphalangeal joint. You can see that labeled here. And between the proximal and middle phalanges is the proximal interphalangeal joint. And we will practice labeling these on an X-ray in lab. So next, let's discuss the joints of the metatarsals. So each of the joints at the head of the metatarsal, or here, is a metatarsophalangeal joint, or MTP. And each of the joints at the base of the metatarsal is a tarsometatarsal joint, or TMT. The base of the third metatarsal, or the third TMT joint, is important to us because this is the centering point, or the central ray location, for an AP and oblique foot projection, again, which we'll talk more about in lab. Sesamoid bones. Sesamoid bones are small, detached bones often found in the feet and the hands, and they are little extra bones that are embedded in tendons, and they're often present near various joints. So remember, in the hand, sometimes you'd see them near the thumb. In the upper limb, sesamoid bones are quite small and most often found on the palmar surface, near an MCP joint, or occasionally at the IP joint of the thumb. But in the lower limb, sesamoid bones tend to be larger and more significant radiographically, so you can see them easier. The largest sesamoid bone in the body is actually the patella, or the kneecap, and we'll talk more about that later in Chapter 6 when we get to the knee. As you see in the diagram here, the sesamoid bones of the foot are almost always present on the posterior or plantar surface at the head of the first metatarsal, near the first MTP joint. And notice there's 2. So specifically, the sesamoid bone on the medial side of the lower limb here is referred to as the tibial sesamoid bone. And remember, the tibia in your lower leg is medial, so that's where it gets its name. The lateral sesamoid bone is referred to as your fibular sesamoid bone, again in reference to the fibula. Sesamoid bones may also be found near other joints of the foot. I've actually seen them here by the base of the 5th metatarsal. Sesamoid bones are important radiographically because fracturing these little bones is actually possible. And because of their plantar location underneath the foot, those fractures can be quite painful, cause a lot of pain and discomfort when you're walking or bearing weight on that foot. You can do special tangential projections. Remember, tangential means you're skimming a body part. So you can do tangential projections to demonstrate a fracture of these sesamoid bones. And if you're interested, there are pictures in your text in the positioning portion of your Chapter 6, and it's referred to as the tangential toes or sesamoid projection. Okay, next, let's discuss the tarsals. The 7 large bones of the proximal foot are called tarsal bones. The names of the tarsals can be remembered with the aid of a mnemonic. Remember, we learned a mnemonic for the carpal bones of the wrist? So for the tarsals, it is come to Colorado the next 3 Christmases. So come to Colorado the next 3 Christmases. If that helps you, great. Okay, the calcaneus, talus, and navicular bones have been known by alternative names in the past. For example, the calcaneus is sometimes referred to as the os calcis, and I will use those terms interchangeably in lab. But the navicular used to be called the scaphoid, and the scaphoid in the wrist used to be called the navicular. And the reason for this is both bones have a very similar shape. But now we strictly call the navicular the bone in the foot, and the scaphoid refers to the bone in the wrist. So they are no longer interchangeable. We keep them separate. Okay, a few other things to note about the tarsals. There are only 7 tarsal bones. Remember, we had 8 carpal bones in the wrist, so that's a difference. Also, the tarsals are larger than the carpals, and they're less mobile than the carpals because they're really bearing the weight of our body when we're in an upright position. So it makes sense that they're larger and less mobile. Okay, last thing before we conclude. The 7 tarsal bones are sometimes referred to as the ankle bones, but only one of the tarsals is actually involved with the ankle joint. So I don't think it's real accurate to call them ankle bones. The talus articulates directly with the tibia, and that is what forms the ankle joint. The other tarsals really aren't involved in the ankle joint at all. Now, we'll talk about each tarsal in more detail in the next presentation, including articulations of each of the tarsals. So we'll pause part 1 here.